Hello and welcome. My name is Mary Swinton, and today I'll be talking to you about my project, TREM2 regulates the phagocytic capabilities of HMC3 cells and its implications for HIV-associated neurocognitive disorders. HIV-associated neurocognitive disorders, or HAND, affects up to 30 to 50% of people living with HIV and encompasses a range of symptoms to include alterations in mood, cognition, and motor abilities. Cannabis has been shown to be neuroprotective in HAND. HAND is characterized by neuroinflammation, and microglia play an important role in this. They exist on a spectrum of phenotypes ranging from pro-inflammatory and toxic, denoted as M1, to anti-inflammatory and neuroprotective, denoted as M2. The M1 toxic phenotype is associated with decreased levels of TREM2, increased pro-inflammatory cytokines, and decreased phagocytosis of amyloid beta, whereas the anti-inflammatory phenotype, or M2, is associated with increased levels of TREM2, increased phagocytosis of amyloid beta, and increased anti-inflammatory cytokines. In this study, we treated HMC3 cells, which were a model for microglia, with HIV-relevant stimuli to include GP120, TAT, tenofovir alafenamide fumarate, IL-1 beta, and amyloid beta, and measured levels of cytokines using quantitative reverse transcriptase PCR. In addition, to isolate the role of TREM2 in modulating microglia phenotype, we used an siRNA. And lastly, in an attempt to induce the anti-inflammatory phenotype of microglia, we used cannabinoid receptor agonist WIN and THC. In Figure 1, we found that HIV-relevant stimuli significantly increased levels of pro-inflammatory cytokines in HMC3 cells, and that this was associated with decreased levels of TREM2. In Figure 3, upon confirmatory knockdown of TREM2, at the protein level, we found that knockdown of TREM2 significantly decreases phagocytosis of amyloid beta by HMC3 cells. And lastly, we found that cannabinoid receptor agonists upregulate the level of TREM2 at the RNA and protein level in these cells. Together, we found that HIV-relevant stimuli induces the pro-inflammatory and toxic phenotype of HMC3 cells, and that this is associated with decreased levels of TREM2. In addition, we found that TREM2 is an important regulator of microglia phenotype. And lastly, we found that cannabinoid receptor agonists can modulate the level of TREM2 and have the potential to treat patients with HAND by modulating microglia phenotype. Thank you.